Do you know someone affected by substance use disorder? Drug and alcohol use is a major health concern, and it's more common than you think. In this video, you'll learn about substance use and abuse, and how substance use disorder can be prevented and treated. Many medications and substances, when used appropriately, help us feel better and improve quality of life. But when a person uses substances inappropriately or excessively on a regular basis, it can interfere with daily life. Substance abuse can affect mental, emotional, and physical health, and negatively impact relationships, work, and school performance. This behavior is called substance use disorder. A person with substance use disorder may abuse one or several substances such as alcohol, tobacco, marijuana, stimulants such as caffeine, cocaine, and methamphetamine, hallucinogens such as LSD and PCP, opioids such as heroin, morphine, and other prescription pain medications, and household items such as cleaners, paint, and glue. Substance use disorder is more likely to develop in people who have a family member who struggles with addiction, have low self-esteem, have a history of depression, bipolar, or other mental illness, or have been a victim of abuse. Additional social and environmental factors may increase a person's risk for disordered use of substances, such as widespread acceptance of alcohol, marijuana, and caffeine use, pressure from friends, especially among teens and young adults, and overuse of opioid pain medicines. When the brain is exposed to a substance, the drug changes the brain's wiring. The substance stimulates areas of the brain that cause you to feel pleasure. Over time, in order for the brain to experience the same level of enjoyment, it needs the substance in greater quantities. As a result, you must take more of the substance to give the brain the same effects as before. This is the cycle of addiction. Signs and symptoms of addiction include using the drug for a long time and needing more and more drug to have the same effect, spending excessive time thinking about using, finding the drug, and recovering from drug use, craving the drug and being unable to decrease or stop using, ongoing use that affects school, work, or home obligations. Other symptoms include using the drug despite the negative effects on your life, missing social or recreational activities in order to use the drug, using the drug when it can be dangerous, such as before driving, showing signs of drug withdrawal when trying to cut down or stop using the drug, and using the drug to minimize withdrawal symptoms. However, all of this can be avoided through preventing substance use in the first place. The most successful prevention strategies begin early, before someone experiments with drugs. Programs for families, schools, and communities educate on the dangers of substance abuse, so young people know how to respond to stressful situations and receive ongoing support. Additionally, since people with mental health conditions are at high risk of abusing substances, getting the right treatment and support for all mental health conditions can help keep certain people from using or developing an addiction. If you are experiencing thoughts or emotions that interfere with your daily life, talk to someone you trust. Talk with a healthcare provider or counselor to help find other ways to cope with stress and emotions. Using substances to cope can often make mental health conditions worse. Seeking treatment for substance use can be difficult. Friends and family members may be the first to notice that substance use is causing problems and can encourage the person to seek treatment. If your friends and family are concerned, it is likely you have a substance use disorder. Treatment for substance use disorder may involve a combination of approaches to help you quit and avoid relapse. Many people with substance use disorder also have other mental or physical health conditions, which can make treatment a complex process and requires trained medical, mental, and chemical health experts to successfully manage multiple conditions. When substances are used to cope with a health condition, physical and emotional pain may occur when use stops. To avoid pain, a person may continue to use or be tempted to use again after quitting. However, treatment can be planned in a way that addresses health conditions and the strong urge to use. Substance use disorder is a chronic disease, so most people need a long-term plan to stop using drugs for good. Treatment may include detoxification or detox with prescription medicines to treat or prevent withdrawal symptoms, counseling or talk therapy provided by substance use treatment counselors, medicines to help treat substance use disorder and prevent relapse, support groups to provide ongoing emotional support, advice, and guidance. After initial treatment, behavioral therapy is an important part of staying sober. A counselor can help you create an action plan to increase your odds of success. This may include finding support systems that can help you stay clean, having a plan for what to do when you feel tempted to use, participating in new activities to replace the old patterns, choosing a sobriety support program such as Alcoholics Anonymous or Narcotics Anonymous. Substance use disorder is a condition that is both preventable and treatable. Committing to a treatment plan can increase the odds of getting and staying clean. Work closely with your healthcare team to develop a plan for success. Talk with your healthcare provider if you have any questions or concerns about your condition and treatment options.